Are orthodontic retainers for life, for 5 years, for 2 years? Watch this video and find out.
How often do you have to replace your orthodontic retainers? Watch this video and you'll find out.
All right.
Okay.
It's literally everything about retainers today.
Okay.
All right. I would like your knowledge, your brains. Let's actually have a nice chat about orthodontic retainers, because people, I bet they have quite a lot of questions.
Let's start about talking a little bit about who actually needs an orthodontic retainer, because most people think that the only people who need orthodontic retainers are the ones who just finished their orthodontic treatment. But I think that's not true.
You think, or you know?
I definitely know that's not true, because we believe that every single person needs actually an orthodontic retainer as they're growing older.
Yeah, that's so true. I mean, people, they don't realize that our teeth, they move forever.
Yeah.
And then the next question is like, why? This is a mechanism, it's a very smart mechanism. I mean, you know it, but we have to share with the people. Our teeth, they are moving constantly towards the middle line. But why nature does that in the first place? Because as we are chewing, our teeth, they are kind of moving up and down a little bit. Mm-hmm. And this up and down movement, as you very well know, is creating abrasion, and the teeth, they get narrower and narrower over the years, like super small amounts, but it's happening. It's a constant process. And if the Mother Nature doesn't move the teeth towards the center, then we're going to all end up with gaps in between our teeth and food getting stuck everywhere.
Yeah, that's true.
Yeah.
There is also another movement that is happening throughout the years, which is actually the natural abrasion that occurs on the occlusal surfaces of the teeth.
You mean besides the left and right?
Yes. So on top of the teeth, yes, our teeth are getting damaged slowly, just a tiny bit every year. But after many years, we can actually see the difference. So then what happens, because our bones, our jaw naturally is trying to fix this issue, the bone itself is grown a little bit vertically as well, just to try to fix this.
Okay, so you mean because the teeth are naturally getting shorter, yes. I'm going to be using the simple word now. So our top and bottom jaw, the bone itself, it actually grows and it compensates for the tooth loss.
Yes.
Nature is amazing, isn't it?
Yeah. Cool. And because of all these movements happening naturally, the teeth tend to move to the front, which means that sometimes, even if somebody has perfectly straight teeth, they might see as they're growing older that their teeth are not that straight anymore.
Yeah, I mean, some people are very lucky and their teeth, they never get crooked. But I would say that majority of the people, at some point of their life, they notice like, oh, when I was younger, my teeth, they were straighter. Now they're kind of like overlapping. You don't even realize it.
When this is happening.
When exactly has happened, you know. At some point you just notice it, and this is a process that goes for years and so slowly that it tricks you to think that everything is fine, but it's not. It's because one tooth, if it overlaps a little bit, then it's a domino effect that starts. By the way, I have promised to myself that I'm going to stop using the like when I'm talking. I've noticed in the previous podcast. I should stop doing that. Yeah, so because of the movement that it happens in order to compensate for the gaps, unnecessarily, we're getting crooked teeth in the end, which tells me that everyone can benefit from a retainer.
That's true. That answers actually the question when people ask, who actually needs an orthodontic retainer? And the answer is that everyone.
The answer is almost everyone, except the very lucky ones that they don't. You know who you are. Well done.
So there are two types of orthodontic retainers. the fixed one, which is a very, very thin wire that we can fit behind the 6 front teeth, either upper or lower, and we have the removable retainer. So, which one do you think patients prefer?
Yeah. I mean, definitely they prefer the wire because it's much more comfortable and less hassle, and they don't have to do anything at night.
But do you think it can actually replace the removable retainer? Because this is a very commonly asked question.
Yeah. I'm not a big fan of the fixed retainers because they can create problems with your gums. Stuff is getting stuck in between.
You cannot floss.
You cannot floss anymore. So it comes with disadvantages. Some people, they manage and they keep like a really good hygiene, like, because you can still kind of floss, but you have to be really, really thorough.
Yeah.
So I would say if you can stay away from the fixed retainer, it's a good idea to stay away from it. But saying that, in some cases it's absolutely necessary, especially with people that they started with diastemas, which is big gaps in their teeth, and then with aligners or with braces they closed them. The teeth they really like to open, like literally the day after.
That's true, and especially during the day that we're not wearing the retainers, the teeth really, really want to go back to their initial position. So indeed, in some cases, a fixed retainer, the one that we fit behind the teeth, is actually absolutely necessary. But for the rest of the people, especially the ones that didn't have an orthodontic treatment before, we can just have a removable retainer, which is a plastic tray essentially, that you can wear every night, and then your teeth can stay in place for a long, long time. Yeah.
Removable retainers, I mean, once you get used to them, they kind of work like a dam. You go to sleep and you're you know, it takes some time to get used to it, but once you get used to it, you kind of miss it after that. So it's a great, great habit to have. Of course, for everyone that had already orthodontic treatments, but for people, in our case, because we do lots of bonding, even without an orthodontic treatment, still they are an amazing way to keep your newly done smile in position. So you don't have to worry that after a year or two, things are going to start overlapping. It can happen.
And also there is another benefit for people that are grinding. No matter if they had their bonding done or not, but especially if they had their bonding done, if they keep grinding on top of it, the composite might get tired. So the retainer can actually help protect either composite or even their natural teeth from grinding or clenching the teeth during the night.
Yeah, it's a win-win. Either you grind the retainer, so you save your composite bonding,
or enamel.
Yeah, and this is why it's a win-win. And then we're coming to the next thing, that how often do we have to replace them?
That's a nice question. So I would say we need to replace them at least once a year, but it heavily depends on the patient.
Yeah, I would. Yeah, I'm usually suggesting, like, after a year, be a bit skeptical about your retainer. I know that people, they're wearing them for 4, 5, 6 years in a row, the same retainer. I don't like the thing is that it kind of gets dirty. There are gonna be microbes there and stuff. Like after a year, 2 years, 3 years of accumulating, this thing.
Especially if you're brushing them with your toothbrush, you're essentially scratching the plastic, scratching the retainer, which means that you are creating all these really tiny cavities that all the microbes can creep inside, and that's not very hygienic.
Yeah, the best place to live there. Yeah. You're creating literally the microbes home there.
Yeah.
Then the other thing is that, I mean, there are these tablets and stuff which you can clean chemically your retainers. Again, I don't like the idea very much because, again, they abrade the material, but this time it's not mechanical, but it's chemical.
Yes.
So the result is kind of the same. Again, you scratch the surface, but not with a brush, but with some chemicals. And then you see these retainers, they usually become this mud, like a fog. It's like they become foggy
They're not very
white.
clear.
Yeah, exactly. It's not transparent anymore.
Yes.
It's losing its transparency, which means that it's really scratched. And this is where the microbes are getting. Well, you can tell that, okay, but that's why I'm using the chemical to kill the microbes, which I agree, but you are tiring the material itself.
Yes, still you are damaging a little bit the material. Also, I need to say something else. After a year or 2 years, people might notice that the retainers, because it's plastic, they're getting a bit loose. They're not that tight anymore. And if the retainers get loose, then they're not actually doing their work. They're not keeping the teeth in place.
For me, this is the biggest problem.
Yes.
That without realizing it, your retainer that you think that is protecting them, your teeth from moving, is actually not. Is actually allowing them to move. And you will, because as we said from the beginning, the movements that they occur over the years, they're so small that you can barely see them. So the retainer now is allowing these small movements to actually happen. And this is where it comes a problem that I think I'm kind of proud that we have managed to solve, actually, because people, they do the retainer, and then after, let's say, 2-3 years, all these micro movements have happened, and they go to the dentist and they take a new impression, but the teeth have moved already.
The teeth are not straight anymore.
They are not as straight as they used to be, and they get the new retainer, which it gets tired after a year or two, and then they check again for an impression, and you get the idea. So you really defeat the whole purpose of the retainer.
That's true. And we have lots of people who say, but I'm very compliant and I keep changing them every now and then. Why aren't my teeth straight? And this is because if you keep taking new impressions, you lost the whole point.
Yeah, that's the reason. So new technology helps a lot here.
Yes.
Scanners, they are changing the face of dentistry. So we scan your teeth at the day that your teeth, they are at the best possible position. And now we have literally frozen a moment in time that your teeth are perfect. And we have a 3D model of that, which is crazy. And we can reproduce it as many times as we want. So if you're changing every year your retainers, which I strongly recommend, then we can reproduce your retainer, even if your teeth have moved a little bit from when they were perfect, like we are using the scan from where they were perfect. That means that the first 2-3 days you're going to feel it a bit like, ooh, that's pushing, but that's a good thing because it's pushing your teeth back to their bestest position again.
Yes, the retainer works as an aligner for a few days, and then when they're perfectly straight, it's still tight, but it's not painful or anything.
I even sometimes recommend to wear them for like 48 hours constantly like an aligner. You probably do the same. Yes. And then once it feels nice and loose, then they can use it just at night.
No, I totally agree. I do that as well. And also another thing that we didn't mention is that people who are grinding their teeth or cleansing their teeth, they might actually damage the retainers after some time. Sometimes even after 2-3 months, you can see some holes on the occlusal surface, and this is because they are grinding so much that they are damaging the retainers. So if that happens and they are not replacing them constantly, they will start damaging the enamel underneath, really.
And the enamel and the movements, they start occurring really much faster because the tray has lost its integrity, so it's not doing what it's supposed to do. I mean, this is a very specific group of people that you're talking about. I'm calling them the retainer eaters. They're literally eating the retainers in like 3 to 4 months.
Yes.
And super proud that we have introduced, I think, a very nice way of helping this particular group of people. It was super unfair, first of all, for them. A typical price per retainer is like 150 pounds maybe per retainer. So if you have 2, you might actually pay up to 300 pounds for 2 retainers. And imagine if you're eating them after 3 months.
Yeah, it's super unfair, and it's actually a quite expensive sport to maintain a really nice, healthy smile.
Yes. And for that, I need to share with the people. We have introduced this kind of like a subscription.
That's why we have introduced our membership plans. This is mainly for people who had to constantly replace the retainers, but obviously they didn't want to pay again.
Yes,
and
yes.
again.
So, yeah, I think we're helping people a lot by doing that. What we do is like, again, the like, there it is. I need to stop doing that. So, ideally, you pay £10 per month. This is what we do.
Mhm.
And you get a new retainer, as we were talking all this time, every year at your doorstep, delivered by the post, which is amazing. And you get all these benefits that we will keep saying, like.
But now it was actually correct.
Yeah, I can use it in this case. So it arrives at your doorstep. We know that the scan is from the previous best position of your teeth. Great, you get that benefit. You don't have to go over for new impressions or scans. Brilliant.
You might have moved as well. You might not be in the same city where your dentist was.
Brilliant. And for the people that they are eating them after 3-4 months, we have included like an exemption that it says, after 4 months, wink, wink, if it's broken or something, you can reorder and don't worry, we won't charge you again.
Yeah, lovely. I think we have covered everything.
We did,
about
indeed.
removable and fixed retainers.
I mean, you know what? I think we can talk forever about retainers. It's like, if you give me another half an hour.
Let's try to keep it short and meaningful.
I would like to say one last thing about the retainers. Yes. The best way to clean them.
Mm-hmm.
Personally, I love these little ultrasound cleaners that they're using water. The reason is there is no chemicals inside. We as dentists, literally, we're using the same technology to clean our instruments, so we won't scratch them.
That's true.
Yes. So having your aligners in these little pots that they're vibrating with the ultrasound, I think, in my humble opinion, is the best possible way to clean them.
But also, if people are changing them every year, they won't have to deal with a big number of microbes in their retainers.
That's true. That's true. Yeah. Yeah.
Thank you very much.
Oh, thank you very much. That was lovely. Stay tuned. We're going to try to upload as often as possible. We're just starting this channel, so we're not really sure how often it's going to be. We
will try once a week.
Maybe. I don't want to promise. But we have busy lives. But I think that these videos are super informative, and people, I think they're gonna just message and tell us, what would you like to know? I mean, we're two dentists, cosmetic dentists, really.
Yes, I mean, leave a comment with your ideas and all the questions that you might have, all the topics that you would like to talk about. And we will be more than happy, actually, to answer all the questions.
Just give us some ideas of what, because for us, dentistry is like our everyday life.
And we keep talking about dentistry all the time, so it would be nice to talk about something that you actually want to hear about.
Yeah. So, throw us some questions, subscribe.
And like and share this video. And we'll see you next time.
See you next time. Bye.